Welcome to this interview for the Society of Sports Therapists. I'm Christian Weaver, and today I'm joined by Emily Goss, a sports therapist who is working in the NHS and a member of the Society of Sports Therapists Communications Group. Emily, could you tell us a little bit about what you've been doing since graduation?
Hi, yeah. So since graduating in 2020, I've worked privately within a clinic where I was a self-employed sports therapist. And also I did quite a lot of their pitch side work. I've also worked in football for a team in the National League South, but unfortunately that stopped due to the COVID pandemic. And currently I'm employed by the NHS, where I'm a band 5 MSK practitioner. Which is great for sports therapists as we're really pushing for these roles for a long time. And we're working alongside the physiotherapists, and it's something that we've wanted.
Yeah, definitely. And just to take you back, why did you choose sports therapy as your undergraduate degree?
Yeah, so I chose sports therapy as it's a subject I'm very passionate about. My sporting background is artistic gymnastics, where I competed to a national level. And during that time I was competing, I had injuries, and I was treated by sports therapists at that time. So I saw what they could do and saw how important they were for athletes. Um, they allowed me to continue training and competing. I also knew people that did the sports therapy course at the University of Chichester, and they said how great it was. So I thought I've got to go into it.
Great, and obviously when you're on your sports therapy degree, you learn lots of skills. So what kind of skills have you been able to transfer into your current role as a Band 5 MSK practitioner within the NHS?
Yeah, so I believe like I use all skills that I learned at university. From the injury assessment to manual therapy, hands-on techniques to rehab plans. I think the undergraduate degree is brilliant because it prepares you to go into the workplace, whether that's the sporting field or the clinical environment or within the NHS. And you're always learning after you graduate. So yeah, it's great.
And then what does your sort of day-to-day work involve, considering this is a relatively new role for sports therapists to be involved in the NHS?
Yeah, so day to day, I'm involved with the treatment plans and of MSK outpatients within a hospital. We have a team that involves band 5 and band 6 and band 7 physiotherapists, MSK practitioners like myself, and our rehab instructors. Um, we have specialists that we can also refer to if people need further imaging or further surgical opinion, if they have quite complex cases, which sometimes they do. We receive the referrals from the GPs most of the time, and we assess and treat them within the department to try and get them as well as we can, as quick as we can. Some are quite complex and long-term conditions, and others are post-surgery and more acute injuries. My daily diary involves about 4 new patients. One of them is an urgent new patient, and approximately 6 to 7 follow-ups throughout a day. So pretty busy.
Okay, and if I can ask you in terms of what kind of injuries that you see within your sort of scope of practice in the NHS?
Yeah, so we see all sorts really. So we have quite a lot of your typical, your bad backs, your sciatica, your more acute things that you can treat. We get quite a lot of the other side of surgery. So your knee replacements, your hip replacements, your ACL reconstructions, people that have had accidents and have got internal fixations, things like that. So we get all sorts of things.
Yeah, sounds really interesting. So if you had one piece of advice for maybe a student who's going through a degree program, what would it be?
Yeah, so I would make sure going through your degree program, you get experience in all areas of sports therapy because you never know when the work is going to come up. So take every opportunity available. Don't turn anything down. Ask loads of questions and make contacts with the right people because you never know when the work will be there.
Excellent. And obviously you've taken on this role, but what's the best thing about working in the NHS from your point of view?
Yeah, I think the best thing about working within the NHS is you're working within a multidisciplinary environment. Lots of people with different skills, different backgrounds, and different experiences. I think every day is a challenge. It's not an easy job. You're dealing with quite difficult people sometimes, and you're never bored. That's one way of putting it. There's always opportunities to learn and grow as well. Hopefully, it will be the start of a snowball effect for sports therapists in the NHS. and more jobs will come up in years to come as well.
Yeah, and obviously within that environment, you're obviously trying to keep up to date with your development. So, is there any CPD that you'll be engaging with to enhance your sports therapy knowledge or your skill base to help support you in your role?
Yeah, so my next CPD that I'll be doing is try and get some experience in other areas of MSK. So, for example, spending some time on orthopedics, so seeing some surgeries take place and seeing the patients either just before and just after, because at the moment I'm seeing them a few weeks after surgery. So I think this will be interesting to see, and it will make me a better therapist because I'll be able to see them at the different stages of recovery, and hopefully till the end, and they're fit and able again. I'll also just be attending any CPDs on offer because, yeah, you can always keep learning.
Yeah, definitely. Well, Emily, thank you very much for sharing the information about your job role within the NHS. And obviously, listeners can look forward to hearing more about more from you in the future, because you're going to be conducting some interviews within your role as the person taking interviews for the communications group for the Society of Sports Therapists. So, thank you once again.
Welcome.